Our findings related to the multi-component activities within schools show that the evidence is sufficient for that school interventions of this kind increase physical activity during the school hours among youth. Of the various interventions that are included in multi-component interventions, you can see the strategies that are effective. They include enhanced physical education, providing classroom activity breaks, including activity sessions before or after school, and including in that active transportation, as well as interventions that build behavioral skills such as goal setting and those that provide after-school activity and equipment and space. Physical education is one where the evidence is sufficient that enhanced PE will increase overall physical activity among youth and can increase physical activity during the physical education class. The strategies that are effective include those that develop and implement well-designed PE curricula, enhancing the instructional practices to provide substantial, moderate to vigorous physical activity during the educational period, and providing teachers with appropriate training. The evidence for active transport to school is suggestive that it will increase physical activity among youth, and the effective strategies include involving school personnel in the intervention activities and also educating and encouraging parents to participate with their children in active transport to school. With regard to activity breaks, the evidence is emerging that school-based physical activity breaks can increase physical activity among the youth. These strategies that have been found to be effective include adding short bouts of physical activity in the classroom, encouraging activity during recess, lunch breaks, and other breaks, and promoting environmental or other system changes such as providing physical activity and game equipment that teachers can use in the classroom or during breaks. Let me turn now to younger children. On this slide, you see the rationale for including preschool and child care centers. 4.2 million children are enrolled in these centers. The evidence is suggestive that interventions to modify the social or physical environment in early child care and education centers can increase physical activity among young children during their school day. The strategies that were applied independently or collectively are shown in this slide and include providing portable play equipment on the playgrounds, providing staff with training in delivering structured physical activity to the children during the school sessions, and integrating physical activity teaching and learning into the actual learning activities for the children. And finally, increasing the amount of time that children spend outside. With each of the settings, we looked at the research needs, and I'm not going to read all of the research needs, but let me just highlight a few that are particularly pertinent. Conducting longitudinal studies with rigorous measures was something that we felt would expand our knowledge and close some of the gaps. Similarly, looking at specific strategies to promote physical activity within the child care setting, and this is a theme in several areas, conducting policy research, as well as looking at research activities that will allow us to better understand effects across race, ethnicity, and socioeconomic groups. Let me turn now to the community setting. Obviously, where people live shapes the sociocultural as well as the physical environment in which we live, and therefore we wanted to see what impact physical activity would have and what the impact might be at a population level. Within this category, the built environment had the strongest evidence. Definition that we used for the built environment included the physical form of communities, how the land is used, both the large scale and small scale built environment, the natural features within a community, including the transportation system and the walkability and bikeability of the environment. The conclusions that we drew was that the evidence is suggestive that modifying aspects of the built environment can increase physical activity among youth, and particularly these aspects of the built environment had an impact, improving the land use mix to increase the number of walkable and bikeable destinations within neighborhoods, increasing residential and commercial density so that people can use methods other than driving to get to the places they need to go, and implementing traffic calming measures such as traffic circles or speed bumps. With regard to children, the evidence is also suggestive that the following kinds of changes can increase physical activity: increasing access to density of and the proximity to parks and recreational facilities, improving the walking and biking facilities, increasing walkability, improving pedestrian safe structures, but also increasing vegetation and decreasing traffic volume and speed, as well as reducing the incivilities and other factors that might make it seem unsafe for children. Within the community setting, the research needs, again, include longer interventions and study periods with longer follow-up, conducting research that allows us to look at the natural experiments that are going on around the country so that policymakers will have a better understanding of what really works, and as I have mentioned before, looking at these interventions across race, ethnicity, and socioeconomic groups. As I said before, I'm not going to go through all of the research findings, rather just hit a few highlights. We also looked within the family and home settings. Obviously, this is where children develop activities and behaviors and attitudes. It's the place that parents have the most control to structure the child's environment. When we looked at this evidence, it was insufficient for us to make a recommendation about the ability of home environments to increase physical activity. Therefore, we have research needs that we would recommend be addressed, such as conducting observational studies to examine the relevance of family and home-based strategies throughout childhood and adolescence, conducting longitudinal observational studies to delineate which components of family life influence a child's physical activity, testing specific strategies that engage parents and other family members in physical activity and promotion, and testing specific strategies to enrich the home environment that in a way that will favor activity over sedentary behaviors. And then, as you've heard me say several times before, looking at these interventions across race, ethnic, and other socioeconomic groups.